$10 billion. I mean, just speak about the magnitude of that. That is by far the biggest commitment of the foundation, isn't it, Bill? I mean, this is by far the largest.
That's right. We've been spending a lot on vaccines. Even that commitment won't cover all the needs, so we need the governments, both in rich and poor countries, to come along. But millions of lives have been saved. With this commitment, over 8 million additional lives will be saved. So it's one of the most effective ways that health in the poorest countries can be dramatically improved.
I mean, the mission of your foundation has been clear. It's all lives have equal value. And this is really putting the stamp on that and saying everyone deserves to have disease prevention. Everyone deserves this. The people you deem those that have the fewest champions. Right now, in the midst of what has been the worst global economic downturn, how do you get the commitments that you need, the help that you need to leverage the billions you're investing?
I think we need to say to governments, this is something that works, that we know works. We wouldn't put our own money into something if we didn't put it down and realize that it's actually making a difference in saving lives. And I think we've seen it so much over the last decade, even with the Gavi Alliance. You know, there are 200 million children that otherwise wouldn't have been vaccinated or vaccinated. There are over 3 million children that are alive because of these vaccines. And the vaccines cost so little money to save a life in the developing world. And it's literally life-changing for that family to have those kids alive. So it's a great investment.
I mean, and you've seen it on the ground. You're just coming off of a trip to Malawi and Benin as well. What did you see that really invigorated you in this commitment to vaccines globally?
What invigorates me is to see a country like Malawi that is incredibly poor. It's one of the 10 poorest nations in Africa, making vaccines happen and work for them. So their country has committed some money. The Gavi Alliance has committed money to vaccines. And what I saw were these incredible health surveillance workers. They've trained 11,000 workers who go out into rural villages where most of their population lives. They work with the mother and children so the mothers understand vaccination. They do some of it in the villages, 3 weeks out of the month. And 1 week out of the month, they're back in the hospital giving vaccinations. And so they're talking to the mothers constantly, not just about vaccines. The mothers are totally on board with the vaccines, but here's how you need to come from your rural area to now deliver your baby in the hospital so your baby can live in that first month of life. And it's just making an incredible difference. And to see a nation like that, who doesn't have very much money, but are actually getting their immunization rates up and really saving lives of these children under the age of 5, it's just incredible.
So you'd call Malawi a successful venture then, in a sense, at least thus far, correct? I mean, somewhere where you can see the results are tangible.
That's right. If you go back to 1990, 12 million children a year died. Last year that was down below 9 million. Now that's 9 million too many, but it's vaccines, it's malaria bed nets that have made that reduction. Now we need to take the vaccines that rich people take for granted, a couple of new ones, and get them out to the poor countries. And then we need to invent vaccines for some diseases that are only in the poor countries. Malaria is a great example of that.
What's the goal here? In terms of this new $10 billion commitment. What's the goal for this $10 billion commitment over the next decade?
The goal is to get the vaccination rate up even higher. And as Bill said, to get the new vaccines that are coming, technologies, there's a rotavirus vaccine. Kids die, 500 million kids die a year of a diarrheal disease called rotavirus. We don't really deal with it much in our countries, but we have this new vaccine. And so to get it out on the ground and get it out in a very quick amount of time to save those lives, or same thing, there's a great vaccine coming for a pneumonial disease that many kids in the developing world get. Making sure that these kids have access to the same technology we have in places like Europe and the United States, and they have it very quickly and that their lives are saved. That's the goal of this whole program.
How many lives do you think can be saved?
We feel conservatively that over 8 million additional lives will be saved during this decade. And the wonderful thing about that is that you improve health, you actually bring down the population growth. So any issue, whether it's the environment, education, jobs, food, are made possible as you get this improved health. And so vaccines really proven themselves, but we're going to need a lot of support in order for them to achieve their full potential.
What kind of support are you expecting to get from President Obama's administration and the U.S. government on this as we grapple with high unemployment in this country and many, many other issues facing the citizens of this country? There are those that will argue we need to help our nation immediately. How do you get the involvement that you're asking for from governments, particularly the U.S.?
Well, foreign aid is less than 1% of the U.S. budget, and this health piece is about a third of that. So as a percentage, it's quite small. And when people in our country hear the success story, when they know you're saving a child's life for a few $1,000s, I think even in a tough time, they want to make that allocation. President Obama made a commitment to double foreign aid. We're not on track to get that, but we're still hopeful that particularly with the help of these success stories, he'll be able to meet that commitment.
You've both written about in your annual letter that was just released about the reality that the Foundation's aggressive goals have been actually harder to achieve than you thought. What's the biggest challenge?
Well, I think there are many challenges, but I think that's one of the exciting things about the Foundation is that we can go out and take risks sometimes that a government won't take. So to go out and say, we set a goal a few years ago saying, let's eradicate malaria.
Well, wasn't that advice from Warren Buffett back in 2006?
Yes.
Don't play it safe?
Exactly. He said, don't just take, the soft, easy pitches. What you all can do is be catalytic in the things that you do. And we can take risks to try and create new vaccines where, there are going to be some candidates that fail or some candidates that point to where we ought to go next. But we're going to keep putting down our bets. And eventually we, with industry and then with the government, will get a malaria vaccine that then can be delivered. And for us, that's very exciting. So while our goals are ambitious, we still think they're the right ones. And we're here to work on this over the course of our lifetime, even if it takes us 10 years, 20 years to make progress on some of these very large-scale goals.